section we're going to discuss isopathy. And isopathy uses microdoses, but it applies them in a different way than we would be using them in standard homeopathic practice. Looking at where we get the word from, isos means the same, whereas homeos comes from a root in Greek meaning similar. In isopathy, we're using an agent to which the patient is having an abreaction or a toxic response or an allergic response, or to which they have a disordered relationship. As we discussed this morning, in homeopathy, what we're trying to do is reflect the symptom picture back upon the patient. We're trying to give them some systems information that will help them reprogram their physiological responses so that they can self-heal. In isopathy, we're doing something slightly different. We're trying to change the relationship with an agent that is noxious to them. Obviously, this has its main relevance to patients who are having allergic responses or forms of sensitivity or toxicity. And we will often in isopathy be using homeopathic potencies of, for example, pollens in hay fever, or nickel in nickel sensitivity, or using potencies of an environmental exposure in if they've got a toxic exposure at work. So you might be using organophosphates, for example, in farmers who are using organophosphates in their work, to try and change their tolerance of them and to reduce sensitization, reduce sensitivity, or reduce allergic symptoms. If we look at pollens, are one of our very common conditions that isopathy is indicated in is hay fever. And there's a clear process. You identify the possible allergens by means of the history. You look at the timing of their symptoms and the seasonal aspects of them. You identify the prevailing environmental factors which modify or set symptoms off. And if there are a number of allergens that are possible, if there are several things that the patient might be allergic to, then you may go on to do some allergy testing, some prick skin testing. Maybe you take a blood sample and look for specific IgE, or other serological examinations for allergy. As a general rule, where you have a patient who has multiple allergies, isopathy isn't all that helpful. You need to use other homeopathic approaches. And the reason is that, for example, if you have a patient with asthma and they've got sensitivity to dog danders and sensitivity to house dust mite and sensitivity to feathers, and they've got an allergy to cotton flock and they've got hay fever, if you try to desensitize them to one allergy using homeopathic preparations of the allergen, the others that they have a sensitivity to will keep the syndrome going. And by the time you've resolved sensitivity to one, the other sensitivities will have kept them symptomatically in the same place. And as a general rule, isopathy is at its most successful when there are one or two very strongly implicated allergies or sensitivities, and they're very clear and objectifiable. And you tend to use the isopathy according to the patient's response pattern. We'll tell you a little more about that. The use of isopathy has a long history, and the link between pollens and hay fever was established scientifically by a homeopath. In the 1870s and 1880s, Dr. Charles Blackley was a consultant at this hospital, and what he did was he erected pollen traps on the roof of the hospital and sent some other pollen traps up on kites, which collected pollen grains which could then be counted in a grid. And he was able to take pollen counts from the air and correlate them against the symptoms that the hay fever sufferers had. And so for the first time, he was able to demonstrate the etiological link between pollens and hay fever in a very nice, very scientific way, using a perfectly objectifiable study. And he wrote his results first in the British Homeopathic Journal, and it was then republished in many other journals, the British Medical Journal and pharmaceutical journals after that. And it's interesting to note that this sort of seminal work has got some echoes in more recent times, and I'll talk about David Riley's work again shortly. Here are some of the allergens that you can find in homeopathic pharmacies. This is just a selection from a pharmacy's list of isopathic remedies that we stock. And as you can see, a lot of the very common allergenic species are available in potency. You have to be a little bit careful, because sometimes when it comes to isopathic ordering, you have to order very specifically the nettle by its common name. For example, nettles are Urtica urens. Urtica urens is a remedy. It's a potency of nettle, but it's not the same remedy as nettle pollen. And so for the isopathic agents, you will very often be using the common name rather than the Latin name. You'll see that there are some there that are still in Latin name, but very often, if you're looking for isopathic agents, you'll be using it, asking for them by their common name. Sometimes, as you'll see from this list, some of the isopathic preparations are directly linked to the test kits that you get, the prick skin testing kits, so that you can get homeopathic potencies of the same combination of tree pollens as exists within the tree mix within, for example, the Bencard skin testing kit. So if they have a positive result to that skin test, then you can order up the specific array of allergens that relate to that in potency. The charts of pollination and sporulation times can be helpful, and you'll see that there's a wide variation in the prevalence of certain seasonal allergens. Some allergens have got a very, very long seasonal exposure, and house dust mites, for example, can cause symptoms all year round. House dust mites sometimes cause more symptoms towards the winter time, when people are in enclosed spaces and where there's relative increases in humidity, which increase the molds that the house dust mite feeds on. So there may be some peaks in the annual exposure, but you'll see that you can have allergic symptoms all year round from house dust mite. Some plants like dandelion and plantain have got very long seasonal pollination times. There are other allergens that have a very short pollination season. So here you'll see, for example, timothy grass or meadow fescue. These have got a short pollination season, and if you have patients who only have symptoms in May and June, you may be specifically interested in doing some allergy testing for those specific allergies or allergens, or you may even simply want to try them with potencies of those specific allergens if you think clinically that's what they're reacting to. Some have got largely springtime aggravations, and the tree pollens tend to be earlier than the grass pollens. And so if you're getting early aggravations, you might of hay fever, you might think of using tree pollens as your first line of approach. And you can buy homeopathic preparations of mixed tree pollens, or you can buy single species preparations of birch or sycamore and so on. So this is a patient where I've done a skin test. It's not terribly clear on the photograph, but you'll see here there is a little edematous area in the centre and quite a clear flare that extends even outside of the ring that I've marked on the skin. And this patient has a single allergen sensitivity to house dust mite in this particular case. I find skin testing can be very effective and very valuable, and I use it a lot in my practice. When I saw it first demonstrated, when I worked in an ENT unit many years ago, I saw very ham-fisted skin testing. I've seen ENT nurses and consultants jabbing people with needles several times and poking their skin and raising little blobs of blood and all the rest of it. This is completely unnecessary. If you have a patient who has a sensitivity, all you need is the tiniest 1 millimeter drop of the test substance on the skin, and I use an acupuncture needle, just a little tiny, very fine acupuncture needle, to scrape only in the very lightest way through the drop into the epidermis. You should see nothing after you've done the test at all. You should see you shouldn't be raising blood, you shouldn't be causing pain, and good skin allergy testing can be done in very small children without any problem at all. Well, I draw my circles and I draw little faces in them, turn them into mice or cartoons, and stick the bleb on the nose and make fun out of it. And it's possible to do good skin testing in very young children with almost no problems. It's virtually painless. I find it very accurate. I genuinely find that the skin testing gives me a very good index of sensitivity to inhaled allergens. It's not so good, obviously, for food allergies, and as a general rule, if you've got people with food sensitivities, you'll want to take a blood test and do specific IG or look for other allergic evidence and do RAS tests. But for inhaled allergens, it's very accurate, and it can give you a clear set of indications as to what you should be using isopathically. And it can, in that sense, be very successful. And I know people who virtually run allergy clinics. They do nothing else but homeopathic allergy. They have their test kits, they have some screening kits, they do some patch testing, they do some skin testing, and their practice is based on isopathy. Then they treat quite a wider variety of problems: allergic conjunctivitis, allergic rhinitis, chronic nasal polyps, asthma, recurrent headaches, eczemas, a whole variety of allergically mediated problems, atopic illness, and they virtually build a practice on good history taking, good allergic screening history taking, few prick skin tests, and the correct isopathic treatment. As I say, if you've got complex multiple allergens, this is not the approach, and there are homeopathic treatments that will allow you methods of treatment successfully for chronic multiple allergic problems, but it's not really isopathic. You have to do quite complex constitutional prescribing, which you'll learn a lot later on. This is a slide showing an extract from David Riley's trials of isopathy. David's trials did not seek to prove homeopathy. What he did was he asked the question, is homeopathy a placebo response? That was his basic question that he asked. And it's important not to confuse the basis for this piece of research. He asked, is homeopathy a placebo response, by asking the question, can ultramolecular potencies do anything over and above placebo? And he used hay fever as a model. That was basically the test model for asking the question, do ultramolecular potencies have biological activity? And his principal trial was comparing placebos versus potencies of mixed grass pollens in hay fever. It was a small sample, so the p-values are quite, the confidence interval is quite large, but it reached a statistical value of 0.2. Principal trial had more people involved in it. Its p-value was 0.001. The confirmatory trial was p 0.003, and by the time they put all four trials together, including the asthma trial, the isopathic pollens in asthma, they had a very, very clear positive result for homeopathy. P-value of 0.0004. So there's only a 4/10,000ths of a chance that these results would have arisen by chance in what were very, very high quality trials. So this has then gone on to be replicated in other centres, and there are other forms of evidence for ultramolecular potencies, but this is one of the more convincing trials. And looking at the pilot principle, the confirmatory trials, looking at the clinical course that patients took versus their baseline for their symptoms, the VAS score that they had at the baseline, you see in this case there was a little aggravation, and then the patient symptomatically diverged away from the placebo values, you see there is a placebo improvement from the baseline, but a much clearer improvement in symptoms when you're looking at the active verum, when the potencies have fallen again and again. So, let's have a look at a clinical case. I'll give you some sound, which is always helpful. No, I won't, because somebody's unplugged it. Wrong plug.
And then that goes down, or it's my face and vice versa. I was actually ready to run to carrot.
Right. I'll just have to play it through the internal speaker here. Okay. So this lady has angioedema.
I had a wee bit of supper about 10:30, 11, and by 20 minutes to 12 my tongue had swollen. And my whole face, that is the first time that has happened, as my tongue and my face swelling together. It's always either my tongue and then that goes down, or it's my face and vice versa. I was actually ready to run to carrot. It was quite horrendous. And I tried APIS, and I just walked about the house trying to do things and read or what the camera said there. I took APIS first, and then I had to inject my adrenaline. But I noticed that time my tongue swelled up, and that time there, that's the last 2 times, the last 2 months. I put the gas central heating on, and I was sitting at the fire where it's a back boiler, you know, our gas fire works in the back boiler, and whether that's triggered it off or not, I don't know.
Have you had the boiler checked recently to make sure?
Well, I get checked once a year, maintenance.
When was the last time it was checked?
About 6 months ago.
Okay, here's a list of isopathic agents from several different pharmacies. Some organic ones, some non-organic ones. Can you see anything there that might be implicated given that history? Sorry? North Sea gas, yes. Certainly the gas that comes into Scotland is North Sea gas. Yeah, anything else that might be implicated? What happens when you turn on a heating appliance? Well, hopefully not too much carbon monoxide. That's an entirely different set of problems you're rising out of that. But what else? What happens when you turn on any heating appliance in the room? Yes. What happens? The air starts to circulate. So what happens when the air starts to circulate? Yes, yes. Heating appliances work by convection, and even gas fires have got convectors and vanes in them that move dust. And so whenever you turn on a heating appliance, the air circulates and dust is raised out of the soft furnishings, out of the carpeting, into the air, and increases in its concentration straight away. And so when somebody has an aggravation of their asthma or their allergic rhinitis or an angioedema, on turning on a heating appliance, you've got to ask the question about dust sensitivity, because that's the allergen that really does increase as soon as that happens.
Does dust upset you?
Yeah, very much so. I'm fanatic with the hoover and weight dust.
Is it because dust does affect
Well,
you?
they told me when I was at the nose and throat that the allergy was you can hoover the mattress, hoover this. They said I was allergic to house dust mites.
Okay, so obviously in an earlier appointment I've kind of missed this somehow. I've given a phenomenological remedy, missing the fact that there is a blocked cure in this case because of a very significant sensitivity to an environmental allergen, which in her case is house dust mite. And there is no question now that we need to give her homeopathic potencies of house dust mite. So we give her potencies of dust, 30C potencies, and this is the review.
I had no swelling at all this month. No swelling whatsoever. I took the 2 on the 16th of the 11th, day after my last visit, and I've had 1 every week. And I've just taken my own tomorrow. I've kept it to the Wednesday.
Do the powders themselves produce any reaction in you of any sort?
Just the slight loose stools, that's all. I do know that the powders did help my catarrh, you know.
Right.
It's really, can feel it a lot easier.
Right, so the catarrh is easier, is it?
Yes.
Why do you think she might have had a few loose stools after a potency of house dust mite? I've seen it once or twice in practice. What happens to the house dust mite you breathe in if you're sensitive to it? Where does it go? Yeah, not only down your lungs. Yes, I mean it produces all this catarrh. I mean somebody who's got a sensitivity to house dust mite has also got an allergic rhinitis, it's got catarrh production, it's trapping all the mucus and house dust mite. In fact, that's what your nasal cavity is for, your turbinates, your little hairs and your cilia. It's to trap house dust mite and trap particulate things in the air. And you've got to actually start to worry if house dust mite reaches your lungs. That's not what you're designed to do. You're designed to filter it out before it gets down there. And of course the cilia, if it gets into the trachea, brush it upwards into your pharynx and it gets swallowed. And so people who've got a very bad house dust mite sensitivity often have some heartburn or some upper GI symptoms because they're swallowing house dust mite infected catarrh. And if you're going to have an allergic response in one part, it may be dominant, but very often they have 1 or 2 other symptoms that relate to the GI tract as well, because that's also challenged by that sensitivity. So in her case, when we give her the homeopathic house dust mite, she has some loose stools, then the catarrh diminishes, and then her angioedema just disappears. And in fact, this long-standing angioedema was cured with homeopathic or isopathic potencies of house dust mite. She simply stopped having any swelling. House dust mite is a very important allergen. It's a very big source of morbidity, and there are tens of thousands of people who suffer from house dust mite allergy, and it doesn't always present in exactly the same way. Some patients with house dust mite sensitivity have got allergic conjunctivitis and they wake up in the morning with dry eyes that are feeling itchy and a bit puffy, and that's the extent of it. Other people have got allergic rhinitis and they wake up feeling clogged with catarrh. Other people have got a higher sensitivity to house dust mite and it produces enough swelling to obstruct their sinuses, so they get recurrent sinus infections because of poor aeration in the sinuses. Some people have recurrent middle ear infections. There are some cases of secretory otitis media that has the basis in house dust mite sensitivity. Other people have been labelled as having migraine or tension headaches and who wake up every morning with a dull, thick head, feeling stupid and feeling congested, and they're brushed off as having tension headaches, where in fact they have a house dust mite sensitivity. Nasal polyps, chronic allergic rhinitis, poorly controlled asthma, and the amount of patients who have got this as the fundamental allergen and who then get complications. They get antibiotics recurrently, so they get gradually dysbiotic. They get changed populations of microorganisms in their nasopharynx. they overgrow Brahamalis cataralis, and then they get catarrhal states, then they get sinus washouts, then they get submucous resections, and the NHS spends millions every year on secondary treatments and tertiary treatments for the complications of house dust mite sensitivity, which could be prevented. And it's a tragedy in a way that there are so many patients who do not receive the kind of simple allergy testing, proper advice sheets on how to avoid exposure, and a little bit of helpful advice on bedding and homeopathic desensitization. That is, I'll tell you a story about that. We had a vacuum cleaner salesman came round for Kirby vacuum cleaners, which are these great big things designed in the US, big chrome things with headlights in the front, that have got drives and wheels that go around at the back. They're very impressive machines that look like old American cars with chrome bumpers and things on them. Well, I thought, let this man go through his sales spiel. And at one stage he unhooked the various appliances from this vacuum cleaner and took the head of it and rolled it across my children's bed and over the mattress. And this is what came out of my daughter's mattress through it with a couple of passes over the mattress. And of course this is skin scales, various danders of one kind or another, and it's absolutely hoaching with house dust mite. And it's very important in your allergic sufferers who've got house dust mite sensitivity to tell them about the bedding. Particularly patients who've got eczema. They're dropping skin scales in higher concentrations than the rest of us, but even when we don't, we're dropping pounds and pounds off our skin every year. We're turning the skin over continuously, and the flakes that come off us are microscopic. We don't see them. They're absolutely tiny, tiny, tiny fragments of skin sloughed off continuously. Now that is the food for dermatophagoides, Pteronismus, the house dust mite, or the molds that grow on these skin scales are. And when you're in your bed at night and you're dropping the skin scales into your mattress, you can start off with a new mattress with only a couple of house dust mite, but they can walk in and out of the fabric like an open door. And it's warm in there, you're transpiring moisture into the mattress and warmth, there are molds growing on the skin scales, and what you start to get multiple millions of house dust mite. And of course when the house dust mite dies, its body gets infected with the molds, and when you turn over in bed at night, you move the air mass in the mattress, and what comes up through the fabric is house dust mite, old skin danders, their feces, their eggs, and the molds that grow on these things. And you only need to be allergic to one protein, and there are actually several allergenic proteins on the house dust mite and their eggs, the body casing, the legs, the genitalia of the house dust mite. They have different allergenic properties. You only need to be sensitive to one protein to get an allergic exposure to keep you sick, to keep your energy low, to keep you catarrhal, to keep you headachy, to keep you with inflammatory problems in your eyes and your nasopharynx, and it keeps people unwell and sick for years. And it makes their asthma difficult to control, and it's a big problem. The only way you can really deal with this is to get a mattress cover that completely encapsulates the mattress. Ideally, obviously, it should be a new mattress, but if not, a mattress cover that zips down the bottom and seals the mattress in, so that these patients, particularly the kids, are not getting a house dust mite exposure at night. You put a nice warm blanket on it so they're not lying against plastic or nylon, and a blanket's washable. You can take it off, you can toss it in the washing machine, it doesn't have an aerosol effect. A blanket isn't going to harbour house dust mite for very long, because you can deal with it, but you can't wash a mattress. And you put the sheet over the nice warm blanket, make sure that the bed coverings are not feather filled, that they're hypoallergenic, that you can toss them in the washing machine. If you're coming from countries where it's sunny, and you hang out your bedclothes on the balconies, the ultraviolet light from the sun will kill a significant number of house dust mite. In Britain that's a bit more difficult. We are not used to hanging our bedding out to air in the sunshine because couple of minutes later we're having a rain shower or something else, and then we've got to dry the whole lot out. But if you reduce house dust mite exposure in your allergic population, you're halfway there. If you give homeopathic potencies of house dust mite, you're 3/4 of the way there. And once you've given constitutional treatment, you may be 90 to 100% there. The skins will settle down in the eczematous children. The allergic rhinitis will settle down. They'll have fewer colds. They'll have fewer sinus infections, and you can entirely change the course of the illness progression. Because what starts off with as being as an inconvenient stuffy nose can end up with really quite significant morbidity after a few years. So never forget house dust mite. It's very straightforward, it's very simple, and it's easy to treat, and it's very important clinically. If you're coming from warmer countries and you have asthmatic people who are your principal allergen might not be house dust mite, it might be Blatta orientalis, which is the cockroach. Because when the cockroaches die, their bodies disintegrate into a fine dust, which is actually highly allergenic. And so particularly from desert countries and warmer climates where there are a lot of cockroaches, and they can be around and they can be very difficult to eradicate. They can just simply be a pest that everybody's got running around. If you've got asthma sufferers in those environments who are aggravated by dust, then think of Blatta orientalis. Blatta orientalis can also be implicated in those people who've got sensitivities aggravated by chocolate, because chocolate obviously contains cockroaches. You're allowed, I think, 2 cockroaches per 100 weight of cocoa beans. But if you've ever seen cocoa beans are exactly the same colour, exactly the same shininess as a cockroach, and it's extremely difficult to extricate cockroaches from cocoa beans. They look exactly the same, only one set are moving, the others aren't. So people who've got allergies or problems with chocolate, you have to think about, there may be an allergy again to Blatta orientalis, and think about that might be the problem. And we eat a lot of chocolate in this country, far too much than is good for us. Okay, so looking at related concepts, autoisopathy, homeopathy and tautopathy. Autoisopathy is where you give the patient a homeopathic potency of one of their own tissues. And it is often used in autoimmune conditions. It is not generally used in isolation as a single line treatment. It is usually used in cases in combination with other kinds of treatment. There are various forms it can take. The form that I'm using at the moment involves what we call a flux potentizer, which is a piece of glassware with a funnel on the top, and you can put samples of saliva, samples of urine, or samples of other body tissues, blood or serum, into the top, and you can run water through it and potentize it in a little glass globe at the bottom of this flux potentizer, and then take that potency and give it back to the patient. This doesn't usually cure a patient in itself, but it can make the difference between you being able to move on a chronic case with autoimmune illness and not. One of my successful cases was a patient with Crohn's disease who I had treated quite successfully for a time, and then we ran out of steam, and she developed large loculations of peritoneal fluid in her pelvis. She had Crohn's disease, which was starting to extend through the bowel, and it was causing all sorts of mechanical problems. She had a paracentesis, and we aspirated peritoneal fluid, and I potentized the peritoneal fluid in a flux potentizer and gave her a potency back of her own peritoneal fluid with all the inflammatory factors and other things that were in it. And she had a good clinical response to it. Her abdominal pain settled, her bowel habit improved, And then she started to respond to classical remedies again, and we were able to move the case forward into a new phase. Sometimes autonosodes in complex chronic illnesses where there's an autoimmune component can be a help as part of a wider prescribing strategy. The flasks that you can use for auto-isopathy are now available. I've been importing them from the Czech Republic, where they've been manufactured, and you can get patients with allergic and autoimmune conditions to make up their own flux potencies by putting some of their saliva into the flux potentizer and potentizing it by running spring water through it. Saliva is very, very rich in surface IgA. It's got microorganisms, and effectively the patient are taking a potency of their own microflora as well as immune components from their saliva and their own enzymes, and it can, in certain inflammatory conditions, move the case forward quite nicely. It does appear quite off the wall, and it's not standard homeopathic practice, and I would say that even in homeopathy it's not what one would call, it is a bit off the wall, definitely. It's not necessarily the place to start with in prescribing, but you should know that it's there and that it is a discipline and a technique that we can use. Homotoxicity is where we use environmental toxins to treat patients. And you can use potencies of lead and arsenic, heavy metals, cadmium, dioxins. You can give people homeopathic preparations of toxins to change their tolerance of those toxins. And this actually has a very, very interesting history. In Germany and in Europe generally, there has been a tendency to use homotoxicity for all sorts of environmental conditions, and people will normally be, a case history will be taken, and certain exposures or prevalences that may be making the patient unwell are then taken into account, and then they're given homeopathic preparations of the toxins that are implicated. Von Reckelweg in Germany is one of the more famous writers, disciplines and producers of homotoxic agents. I think the original physician himself is now dead, but his works and his pharmacy live on, as far as I know. In this country, homotoxicity hasn't taken off to quite the same extent. There are some animal studies that have been done, that are really quite convincing. There are studies written up in the British Homeopathic Journal and in toxicological journals, in which populations of rats have been poisoned artificially with lead acetate or arsenic, and then have been given homeopathic potencies of lead or arsenic, and have shown against a control group a clear increase in the urinary excretion of the heavy metals, and then at autopsy you can demonstrate lower tissue levels of those components. So there is scientific evidence that shows that the body handles toxins differently when it's exposed to high potencies of those toxins homeopathically. There's some very interesting information coming out of America from a group of toxicologists there, led by Edward Calabrese. Now, Calabrese is a scientist, and he insists that his work has got absolutely nothing to do with homeopathy, because inevitably homeopaths have tended to latch onto it. And he's also in opposition to a lot of the orthodox thinking that comes from the environmental pressure groups. You'll be aware that a lot of the environmental pressure groups, particularly in the United States, are very vocal about environmental levels of cadmium and dioxins, and they insist that there mustn't be any of these in the environment because they all pose a risk. Well, the paradox is that if you have small, tiny exposures to dioxins and organophosphates and environmental toxins, that your tolerance of those at higher levels increases, and that small doses of toxins have a protective effect. And what Calabrese is doing is he's actually studying the effects of microdoses of these toxins in biological populations using experimental models, but also looking at human populations as well. And basically what he's showing is that there is a biphasic dose response curve for everything, and that tiny doses of toxic agents stimulate biological systems into a state of protection and improved tolerance to higher doses. So tiny doses of toxins aren't necessarily all bad. They change our tolerance to higher doses. And homotoxic treatment, homeopathically, is in a way an extension of that. It's the use of toxic agents in potency to improve tolerance. Tautopathy is the word that we use when we're using an orthodox drug in a potency. Now sometimes we can be using that because there is a clear problem emerging out of a drug. So for example, some of you may remember the Oprin affair a few years ago. Oprin was a very successful non-steroidal anti-inflammatory drug. It was very good at reducing pain, but unfortunately people who used it got a very bad photosensitivity, and it didn't disappear when the drug was stopped. So patients who are still suing the manufacturers of Oprin years later because every time they go out in the sun their skin flares up and they get an inflammatory response in the skin. And this is a toxic effect of the Oprin. Now in those patients you can give homeopathic potencies of Oprin. You can give the drug that causes this induced sensitivity. And you can do it for other drugs as well. If you have ACE inhibitors that are causing unacceptable side effects with coughing, give potencies of ACE inhibitors. In your patients who've got HIV, who are HIV positive, use homeopathic potencies of the antibiotics to help reduce sensitization. It can be very important, particularly with drugs like cotrimoxazole, because your HIV population may sooner or later incur a PCP pneumonia, and if you're not able to treat them with cotrimoxazole or something pretty similar, it can make the difference between life and death. So in the earlier stages of HIV illness, it's perfectly legitimate to use homeopathic potencies of Septrin or any other antibiotic to reduce sensitization, because it may ultimately become a lifesaver for that patient. There are some studies done. The late Jean-Bernard Crapin in France did a very nice preliminary studies using homeopathic preparations of antibiotics in HIV sufferers and showing that you could reduce sensitization. Also think of it in your cystic fibrosis sufferers. You can use potencies of antibiotics there as well to prevent sensitization. So tautopathy is the use of an orthodox drug in a homeopathic form to help to change tolerance to that drug or to resolve side effects that have emerged from that drug. And there are lots of drugs available. All the statins are available, the beta blockers are available, all the cytotoxic drugs that are used in chemotherapy are available in potency. There's tons and tons of stuff there that you can use and integrate with your orthodox prescribing in ways that will help to improve side effects and tolerance. You could do. I mean, the question is how important that is in every day, because people who have got who already have a penicillin sensitivity, it's highly likely they're going to be avoiding penicillin for the rest of their days. Maybe if it crosses over into other cephalosporins, and then you might want to use them to try and prevent that, so that, or to desensitize them over time, so that if they do need a drug from that class, that they're able to tolerate it. A lot of the time what you wanted to try and do is to prevent sensitization if you can. But if there is sensitization there, then there's no harm in using the isopathic preparation. You may be able to change or reduce that sensitization and improve their clinical response next time around.
Do you stop that drug for a while, or do you give it parallel? Let's say you give a statin and cause transaminitis. Do you stop the statin and then give them the homeopathic dose, or do you just continue the statin and add it on?
It depends. I mean, when it comes to statins, in the short term, statins have got really no implications for health, because if you stop the statins, you're not suddenly going to drop dead of a stroke. The whole issue around statins has to do with long-term risk. It has to do with the perception of the long-term risk of cardiovascular conditions. If you have a significant and serious side effect from your statins, then the whole risk risk-benefit balance shifts, and they probably become contraindicated. But sometimes you can get minor effects from statins. So, for example, I had a patient who had bowel problems, and who had a very dysbiotic bowel, had a very abnormal bowel flora, successfully treated with a homeopathic bowel nosode, and he went into a good clinical response. But when he started statins by his GP, his symptoms slipped back, and he didn't respond to the bowel nosode. He actually had an aggravation of his bowel symptoms, and he stopped responding to the remedy that I would normally have used to treat him with. So I gave him a homeopathic potency of the statins, which resolved his bowel symptoms by 20%. Then I gave the bowel nosode, and this time it worked. And the combination of using the isopathic statins to improve the tolerance, plus the correct bowel nosode, resolved his bowel symptoms, and then he remained tolerant after that. In his case, the side effect, the problem that arose out of the drug, wasn't immediately life-threatening, it wasn't really severe, and the risk-benefit balance of the statins was probably still on the side of the statins. So the isopathic potency of the drug, in combination with other prescribing, made the difference between him being able to stay on statins and not, effectively. So the individual case will tell you what you need to do.
What if somebody had developed like transaminitis?
If people develop a really significant side effect from the statins, the risk-benefit balance shifts from them, and I personally would not persist with them. You know, it may be that you can modulate or change it with the potency of the statin, but there's a question whether or not you want to take that risk, or whether particularly when there are lots of other lifestyle factors you can build in, dietary changes, the use of essential fatty acids, use of bezafibrate inhibitors, there are lots and lots of things that you may add in that change the overall risk equation for them in the long term that have got absolutely nothing to do with the statins. And so it depends on what your perspective and what their perspective is of risk, and it's not a clear-cut thing. And I do not believe that you can project upon the one individual the risks that you see, the risk-benefit balance that you see in populations. What is relevant for a population is not relevant for the individual, particularly if they have side effects from that drug. It's a different risk balance equation for the individual, and it's important not to force a protocol upon an individual whose biochemistry is telling you that the risk-benefit balance is in a different place for them. And that's an issue for us. So I think I saw somebody at the door trying to tell me that I was overrunning, so I'm probably trying to wind up here. Just before I go, I want to show you a little short section, this little section here, just to expand on microdose phenomena. There is in literature, and the pharmacists and pharmacologists and you will know about Arndt Schultz principle. In biological systems, the effect you get from a drug is not a linear thing. As you increase the concentration of a drug going in, you don't get a response that goes up like that in a linear line. The response is a biphasic dose response curve, and this is well established for nearly every substance. Tiny doses of a substance stimulate, higher doses stimulate and then inhibit, and very high doses, of course, cause a stimulation and a complete freezing up of the system and can cause death. They're lethal. Everything has a toxic profile. You can see this in something like digoxin. If you give a tiny dose of digoxin, 100 micrograms or 50 micrograms, the drug has a stimulatory effect. It produces an inotropic effect on the heart. Heart efficiency improves, it stabilizes, it reduces cardiac arrhythmias, efficiency in the system improves. If you increase the digoxin, you will produce a counter reaction. In this case will be blocked. You will actually reach a place where they're digoxin toxic, you'll get a lower efficiency, you'll get increasing arrhythmias, you'll have an impaired cardiac function. And of course, if you give a sudden high dose of digoxin, which is inappropriate, then you can kill them. That's the end of the story with the acute toxicity. But interestingly, in the biological world, everything has this. Even if you take a tank of locusts and you expose them to a tiny, tiny dose of DDT, a subclinical dose that doesn't kill them, they'll actually procreate faster and turn over their reproduction faster than a control tank. In the biological world, the things that we put into the biological systems all have a biphasic dose response curve. And homeopathy is operating often in this microdose area where we're using tiny doses to stimulate altered response or to stimulate an improved function. Whereas orthodox medicine is using the inhibitory part of this response curve. It's using the part that actually produces blocking or inhibition to control symptomatology. And of course, this is the realm of toxicology, where you're using extremely high doses to produce a toxic picture. To give you a little example, I'll introduce you to first to the idea of hormesis. Insects, because their antennae are presensitized to pheromones of the same species, only need one or two molecules to produce a sexual response. The concentrations are unimaginably small for pheromones. A couple of molecules onto a sensitive membrane, you get a cascade biochemical response, and the insect goes off and looks for the source of the pheromones and has a sexual response. And biological systems that are sensitized to receive a trigger are extremely sensitive. We tend to forget all about human sensitivity or biological sensitivity because we're so often involved in using gross quantities of drugs and slapping higher and higher doses of steroids on to get the level of suppression that we're looking for in the skin. But in fact, biological systems, particularly ones that are disordered in some way, are highly sensitive to the correct stimuli. And the phenomenon in the biological world is that of hormesis. And if we look at a particular example, this fellow is called Leonterra splendida, and he is a tree frog who comes, I think, from South American jungles. He's been the subject of investigation by an Australian group of scientists. And if you put 1/10,000th of a gram of the female pheromone in a litre of water, then this fellow gets very excited. And he wants to hop on her lily pad. But if you increase the concentration 100 times, the frog doesn't get 100 times more excited. He doesn't suddenly explode with passion. He gets confused. And the whole essence about microdose phenomena and hormesis is that they are designed to operate at thresholds of exposure which are extremely small. They are biological signalers. They are not in themselves drugs. They produce a cascade or a biological set of cascade responses. And this may have some relevance when we're looking at the models for action for some of the microdoses in homeopathy. Okay, so that's a little aside. And I think I should probably stop and let someone else speak. So I'll go and see if they're waiting.